We here at the DadLabs, we're big sports fans. Our kids are among the 30 to 35 million American children that participate in organized sports. We really like them. Unfortunately, with sports, it's going to come some injuries. The CDC reports that 3.5 million kids under the age of 14 require medical treatment as a result of sports injuries. Now, over half of those result from unsupervised activities like bike riding, but still, there's a lot of injuries that are happening out there. So as parents, dads, we're on the sidelines. We need to be prepared in case our kid gets hurt, and they need to know how to act. So we've brought in Nurse Mark. We've pulled him out of the ER. I hope there's somebody there taking your place.
I hope there is too, Clay.
Pulled Nurse Mark out of the ER to come talk to us about sports injuries. Mark, as a former coach, you know all about these things. Tell us, what do we need to know about sports injuries on the sidelines there?
Well, the most common sports injuries that we're going to see are going to be sprains and strains and possible broken bones and bruises. Mm-hmm. So we see those a lot, so we have to know how to deal with them.
So how do you know? Kid falls down, maybe twists his ankle a little bit. You know, it happens all the time on the basketball court and soccer field. When do we need to go into the doctor's office?
Well, Clay, that's a great question. And the answer to that, really, you can't tell if it's a break or a sprain until you get an x-ray. So how do I know when I'm thinking it's bad enough to get an x-ray? Well, if we see any discoloration or we see any deformity, swelling, pain on palpation, so if you touch the area and it's very painful, that's a good indication you might have a break, and you're going to want to bring them in. So
I've been hearing a lot about these stress injuries or repeat use injuries, that they're really on the rise. What's that all about?
Well, that's the greatest increase in activity in pediatricians' offices are seeing these types of injuries.
I mean, this is because people are taking their 8-year-olds and they're doing nothing but throwing a baseball from the fall to the summer all year long. Is that what's causing these injuries? Or
well, not really.
Has everybody gone nuts? Is that what these injuries are about?
No, it's not that overzealous dad that wants, the next Roger Clemens to be their kid. Really what it's a result of is repetitive action without much warm-up or without any proper training. So often you see a kid just join a team and they start practicing 3 or 4 times a week, and after a month or two of that, their ankles are sore if they're doing soccer, they're running, their elbows are sore if they're playing baseball. If they're swimming, it's their shoulders. Gymnastics, it's going to be their hands or their wrists. And so in those cases, you just want to start slowly. You don't want to practice 3 to 5 times a week. And most importantly, if your child is complaining about it hurting, let them rest. Let them take some time off.
Okay, so you've got an injury, minor injury. It's not a broken bone. You don't have to take them into the hospital. What should we be doing at home? How do we treat these minor injuries that we're not taking to the hospital at home?
Well, Clay, that's another good question. And we use the acronym RICE to help us remember how we're going to treat these at home.
So if a kid's hurt, you feed them rice?
No, you remember RICE because it's easy to remember. And we use that acronym to remember rest, ice, compression, and elevation.
Got it. Okay.
So rest, you just don't want them to be on that injured area. You don't want them to use it. If it's an arm, that's pretty easy to do. Just say, hey, let's do everything left-handed. If it's the right wrist, that hurts. If it's a lower, a knee or an ankle or a foot, you want to try to stay off that. So that's rest. Okay. Ice, you want to put ice on for 20 minutes at a time, and you want to do that every couple hours for the first 2 days. After 48 hours, the ice is not effective at all.
That's a tough one, man. My kids, the young kids particularly, they won't hold still for that ice. It's too cold.
Well, what you want to do is just tell them it's only going to be 20 minutes. Put it on with some elastic wrap. Keep it there. They can watch TV. The elevation part of rice is the one you want to keep it elevated so that all the white blood cells and all the blood that's rushing down to that area that's helping produce that pain is going to be going the opposite way with gravity. What you see in front of me here are some compression devices that we'd give in the hospital. Simply, we could use tape or elastic wrap, but we also have some of these more formal devices that are going to allow compression to keep that area from being swollen, being painful.
Okay, so we've got fractures, strains. What are the other injuries, sports-related injuries that really we should be concerned about that cause you concern in the ER?
Well, the thing that you worry the most about, which could be catastrophic, is a head injury.
Okay, so how do we decide? Kids, happens all the time in the field. Somebody's bonking heads, somebody's falling down. How do we decide whether we're going to go to the hospital with an injury that's to the head?
Well, the most important thing was any level of consciousness changes. Did the child lose consciousness? Did they black out? Do they have any what we call amnesia? Can they not remember what happened? Clay, anytime any of those symptoms, you immediately go to the hospital.
How about if you just got a really dumb kid? I mean, is that something? How do you tell? Like,
Well,
if he's just like really stupid to begin with, and then
Well, maybe that's a different conversation.
how about, okay, so also you need to watch out for somebody gets sick, right? Kids throwing up.
Right. So obviously, any loss of consciousness, that's big. But if you find that your child is not behaving normally, if their baseline is not being met, ask some simple questions. If you're dealing with a young child, give me the days of the week. And if you know they can do it and they can't after a head injury, that's symptomatic. Also, we worry about vision changes. If they start seeing spots, they start, any kind of blacking out, that type of thing. And if they get sick, if they're vomiting, nauseous, that's indicative of a head injury.
How about a headache? I mean, a lot of times, kids complain about a headache that evening. Is that something to worry about? You go to the hospital with that?
No. So a headache is going to be pretty normal. Actually, there are a lot of reasons why that young athlete might have a headache, including dehydration. If the headache is bad enough that it bothers them, then that's bad enough for you to see a doctor.
The other thing that I hear about is, with a head injury, you need to wake that kid up and check them every couple of hours. So let's say that two kids bonk their heads. It doesn't seem like we need to take them to the hospital. Maybe he's got a little bit of a headache. Do I need to wake that kid up every 2 hours and check him? Or
no, you don't. So if you've watched them closely and they don't have any of the other symptoms that I mentioned, the nausea, the vomiting, the level of consciousness changes, they're alert, they're oriented, they're able to do the things they normally do, and they have a little headache, no, we don't need to wake those children up at night. And the bottom line is, Clay, concussions are fairly common in sports. And what we worry about is if they actually have a brain bleed. And the only way to diagnose that is to have a CAT scan. And you can't do that at most local, doctor's offices. You've got to go and bring them to emergency room and get that taken care of.
Well, that's great. So we've learned a lot about head injuries and sprains and strains. Thanks a lot for coming in and giving us the information on these sports injuries. We love sports. Keep playing out there, but keep those kids safe. Thanks a lot.
Thank you.
Appreciate it for coming in.
So do you want to try some of the stuff on?
Yeah, definitely. So how do you deal with the parents on the sidelines that are like going totally nuts?
Well, it's funny because
this
past weekend my son was in a basketball tournament in Houston, and I was working in
and
the
you
hospital.
Went nuts, didn't you?
I didn't.
Did you get thrown in jail?
He went down, and my wife just sat there.
You deck some
I
poor
was
guy.
in Austin. I wasn't even there.
You
But my
kicked
wife's in the
somebody's
stands, and
ass.
she's
I've seen
playing
you do
it
it.
cool. She's
You go
totally
kooky.
cool.
I
And
know
one of
it.
the parents yells, "Your baby's bleeding!" And she
What?
runs down. He's got a cut on his eye. He had spent 4 hours St. Luke's emergency room on Sunday getting his eye stitched up.
You punched him.
I was in Austin, I promise.